areas. So you see I did clinical, and now I'm going to explain how I'm doing more community outreach. And these are just positions of community events that I've done. We've fed hungry, we have done vaccinations and blood pressure checks and diabetes screening for different establishments and community partners. So this is basically a chart of how you can kind of get into the field. It's so I've known people from my LPN days when I worked in a nursing home. And so I know people who are now nurse practitioners all the way from being a CNA. They worked all the way up that entire track. So this is just a model, but there are a lot of ways to get in it. So when I was explaining that I went into the LPN program, a lot of people will do the LPN track because it allows for them to work while they're working on their associate's degree. And working as an LPN usually gives you a pretty decent livable wage. So it's a job you take on, you can survive off of it, and you can pursue your career. There's a lot of flexibility because there is a lot of demand. And again, it was a 12-month program for me. You could only miss 3 days in the entire year you were in that program. Otherwise, you would have to repeat that particular quarter, and it started from scratch. And then you go on to get your associates. Some people go straight from getting theirs out of high school and enter a BSN program. So you can skip all of those steps, go into a bachelor's program, you get accepted. PLU is one of those that you straight in to the program. You can get your master's in nursing, become an educator. I wanted at one point to be the first thing that's the certified registered nurse anesthetist. And basically I would be under like an anesthesiologist, managing pain clinics, putting people to sleep for surgeries. So you can become an what we call advanced practitioner. And that allows you, in Washington State, you're allowed to even write your own prescriptions when you do these things. So you can manage your own clinics, especially in rural areas where the demand is high and they don't have enough physicians to man the stations. You would be able to man your own clinic. And some people will go on to get their doctorate's degree. Washington State still has a couple programs that allows you to become a nurse practitioner with your master's, but eventually all of them I hear are going to be transitioning to require your doctorate's degree in order to become an advanced practitioner. Some people like me, I went and got my BSN. I will not go on to get my MSN. I will not go on to get my doctorates. I will go on to get my master's in health administration. So that again, remember I said I had that business component before I had gone into nursing. And so that allows me to tie in both sides of my desires. And this is what I love about nursing. You can go into so many different areas. So this is just an example of a track you can take and the different levels and how you can skip steps and not skip, but not have to start off at one level and move up. So what do I do? So community outreach liaison, our job at MultiCare, we've kind of tied it into a clinical position as a nurse. And the reason why we do that is because we're a hospital, right? Community outreach liaison, you can see this at any type of establishment. A lot of times it's nonprofit organizations. We are a nonprofit organization, but because we're medically based, we prefer to have somebody as a clinician because we do different things to assess the community needs. We call it CHNA, community health needs assessments, and we see where there's gaps and where there's holes and where the deficits are. We also do things like we do blood pressure checks. And the reason why we do the blood pressure checks is what I do is I get people's age, their ethnicity, and I get their age, ethnicity, and then I also get their blood pressure. And if we seem to see a trend, I provide that data to somebody who processes it. And then they say, it looks like we have a lot of Black or Asian in this particular area that have high blood pressure and it's unmanned. We understand at that point, there's a need within that area and that community to do more outreach about blood pressure education. We can then inform the doctors and then they can start taking route to how they want to address some of those concerns in the patients that they have. So what we kind of do is, if you could read there, we offer programs to groups outside of the hospital walls to provide a positive impact on local citizens, health behaviors, and lifestyle choices. So that was when I was saying we do the blood pressure checks. We also do the diabetes FYI, doesn't mean you're going to get it, but that you can be aware, and that's something that you can check on, manage your symptoms, manage your lifestyle. So some education, and just giving them some information on how to possibly avoid healthcare crises and prevention. But we also man programs. So you can see here that we have patients, we have students, we have the community at large. We provide programs to them so that they can have access. We have to think about some of the health disparities in the community right now, and people don't have access. So we try to meet the people where they're at. One of the examples of that, I just did a pop-up COVID vaccination clinic in Shalishan because we know that that area, there's language barriers, there's registration barriers, technological barriers, all of these factors go into play. So we meet the clients where they're at so they can have access to some of the healthcare needs as everyone else. So kind of creating that equity. And then what we do is we also create basically partnerships, right? The hospital can do some things, and that's great. And we have patients that come to us, but again, meeting the people where they're at is the way to really change how our healthcare system works. So we create partnerships, like how we're partnering with the schools right now, how we partner. We've created clinics in Oakland High School. We've provided a clinic inside of there. We've created Health Careers Academy. Some of you guys might be a part of Health Careers Academy. We've put that in Stadium High School in Mount Homa so that you guys can have access to knowing what's out there in terms of professions and different things like that. So that's what we do. We cultivate relationships with not only our patients, but also the businesses out there, because it's going to take the entire community to make the community healthy, if that makes sense. So what is this? This is one of the biggest projects that I work on. And so the reason why I'm giving a little bit of background to it is because it's just so that you understand that we create these projects and these programs for our community. So MASH Camp is one of the programs we do. Some of you guys might know it as Nurse Camp. And that's one of the programs that we do for youth enrichment for high school. And the reason why we do it is initially started off as shortages in healthcare. And so now we do it because we need to diversify those in healthcare. And the reason why we need to diversify those in healthcare, the studies have shown that if the clinician population or those who service the community look like the community, the health outcomes are better, right? So you see somebody that looks like you, somebody who has the same religion as you, who understands some of your traditions, they can give you care based specifically on your background, or it creates a trust in a community that doesn't has not had trust in the healthcare system before. So this is why we do these programs, again, to diversify the workforce, to change the demographics. It's important to the health of our community. And that's what I basically do. Some of the other things that I do is I do the blood pressure checks. We do sports physicals. That's what we recently did. So we partner with Tacoma Public School Systems, and we provide free sports physicals because we know that our students need that access. We know that they need to have that that concern addressed in order for them to be more active, in order for them to get the vaccinations they need. We also usually offer dental there, some type of cleaning or assessment. So, just meeting the people where they're at, getting the needs that they need to have. That's what I do. That's how I got to my path.
Great, thank you so much. That was really, really helpful, and it was a great overview. I know that we have some questions, so I'm going to ask Ferdosa. I'm so sorry if I mispronounced that, but would you like to unmute and ask your question?
Yeah, for Miss Nancy.
Mm-hmm.
So where did I came here a little bit late. So where did you start off in your career? I have a couple other questions.
I started off, again, associates in business, community, the economy crashed, got my LPN at Clover Park Technical because there was a 1-year wait at Pierce College and didn't want to wait and waste that year. So I did the LPN program because that is the first year of the RN program in Washington State. So then it allowed me to continue on. And from there, I went in a nursing home, and then went on to get my regular associate's degree. And then from there, I went straight into the ICU, intensive care unit, for those who don't know. The sickest of the sick go there.
So my next question is, since I'm also a female POC, so what was your experience in like school and stuff as a POC? And like
I'm going to be 100% honest. Anything you get from me that's all I can do is be honest. So for me, the biggest issue was just not seeing a reflection in my classrooms, if that makes sense. So I was in my bachelor's program, and I believe it was me and one other Black American, and then one Nigerian American. And you know, it just gets a little concerning sometimes, because you know that if the workforce doesn't reflect the population, then you know that the population, the community kind of suffers because of that. So it's kind of frustrating, you know, you're trying to figure out, and then you start to question, why are there not a diverse group of people in my class? Is it because you're not accepting them? Is it because, you know, you play these thoughts into your mind? So it does kind of mess with your psyche a little bit. But overall, I had really good experiences. Pierce College was amazing. They actually were intentional about doing diversity in their recruitment. And so there was a lot of diversity there. But my experiences weren't too bad. Workforce, you run into a little bit of issues, but school-wise, I actually, it was pretty good.
With the workforce, sorry if anyone else has any questions, but I just am really interested in this. So did anyone like discriminate against you? Because I really don't want that happening to me.
You know what? I can't guarantee that that's not going to happen to you. And I won't say that I was discriminated against, but there were times where I believe that there was some targeting, some, you know, racially insensitive comments, some microaggressions. Those things are going to be part of life, and those things it's going to be how you handle them. And sometimes it's really about educating the person. You know, somebody who thinks they're really down and feels like they can use terminology that's not acceptable, or some of them that make comments that are racially insensitive, but they really don't realize that they're being insensitive. I'll give you an example from my own stepfather, who raised me like a daughter since I was a baby. One time he said to me, you know, oh, I think we were watching Miss America, and he was like, oh, she's pretty for a Black girl. And he grew up in Emmitsburg, Iowa, where the population of Black people was 0 at that point when he grew up. And it was one of those things I had to say to him, why did you say for a Black girl? And he was like, oh, I don't even know why I said that. And it was an educational opportunity for him. So I think sometimes these moments that you'll have with these people are just going to be a time to educate. And if it doesn't, we do have systems built in to escalate and teach some cultural sensitivity to those people. And if they can't get a hold of it, then usually they get cut.
Thank you so much.
World is changing.
Is there anyone else with a question? Nico, would you like to ask your question?
So like you said, you worked in the ICU. Was that like hard for you? Like, was there anything traumatic that like affected you in any way?
I'm back. It disappeared. What happened?
I'm not sure, but I see you again. So
are we done?
No, we're not done.
No, you're not done, Nancy. I think there was a technical issue. Your video stopped out, but feel free to keep on trucking and answer that question. Do you need the question repeated?
Okay. Yes. What was the question again? Oh, was it hard for me in the ICU? It was very hard. I'll give you one scenario for me. Really kind of, it takes a special kind of person. If I want to pat myself on the back, I'm going to. I'm not going to pat myself on about anything else. It will be about that. You see a lot of heartache, and you see, you know, sick people, and you see the families that have to deal with the aftermath. It taught me to be so non-judgmental. One of the biggest issues I ever had was I got kicked by a patient, and I was upset. You know, but somebody kicks you, your gut instinct is to be like, yo, wait a minute, you know? And we ended up having to restrain her and medically sedate her. She was coming off of drugs. And I was upset. But I still had to be professional. I went to her chart and I looked up her records because that's part of what you have to do when you see social works on a case, that you look up the history. And what I saw was around the age of 13 or 14, she had been sold off. She had been forced into prostitution, and they had forced her to get her to do drugs to get her addicted so that they could make money off of her. So it really made me step back and say, I wanted to come into this situation and be mad. I wanted to come and judge this person. After you get several drug patients, day after day, sometimes you get a little jaded and you don't realize how insensitive you're being and how, you're not really being understanding to that person's scenario, and you don't know their history and you don't know their life. And that made me really just say, I'm going to take a moment to always think that my patient has a history, and my job is to just treat them like I would want to be treated, and with that level of respect. So it was hard. I've seen some things. I've gunshots to the head. I've seen, strokes on women who were young with young children. I've seen everything. And each situation I treat individually and with respect because of that patient. So I'm glad that was a life lesson that changed me forever. So it is hard, but you do have some takeaways.
Thank you. That was a great question and a great answer. Does anyone else have a question? I have a question. What have been your biggest barriers in terms of getting through that whole educational experience? Was it money? Was it time? How did you make that work?
So for me, it was all of the above. You try to apply for financially, you try to apply for scholarships. By the time I did everything wrong, right? I wasn't your stereotypical student. I was in the IB program. I dropped out of high school my last 3 months. I went and got my GED. I would have graduated with the top 10% of my class based on my scores. Wrong. I had 3 kids by the time I was 21. I had 3 kids. I started off a nursing school with 4 kids. So my story, I was supposed to be a statistic. Think about that. So I had a lot of challenges trying to raise kids and go to school and work. And there were points in my life that I was literally up for 24 hours. I would work a double weekend as an LPN. We called it a 32-40. You work 16 hours, night shift, swing shift and night shift. I get off in the morning, go straight to my school, and I'd be in school all day. So I'd be up for over 24 hours every Monday. So there are always going to be challenges. There are always going to be roadblocks, but I'm telling you, if I could do it, you could do it. I'm just here to say there's going to be financial challenges. Find your resources, find your counselors, seats, do the scholarships, find a way, find a mentor, call me, I can be a mentor, but find that person that can help you navigate the system. I think there's systems in place now to help all of you guys. We want to see you guys succeed. This is why we're doing this camp, right? Because we want to see you guys succeed. Use your resources.
Excellent answer.
I think Nico in the chat had a question.
I think that might have been answered.
Okay.
But I think, do other people have a question? Yeah.
They want to know what I like. You guys want to know something about me?
Yeah.
My favorite surgeries are amputations.
Why?
Because I love holding amputated body parts. I think it's amazing that this used to be on a human being and I had to take it off in order for them to be better. And now I have a leg in my hand. I'm a little weird. I don't like working on children because it makes me sad, but I like shaking hands of arms that weren't attached anymore. Weirdo, I don't know. This was probably my calling. See, you get it, Chris. You get me, Crystal, right? Putting toes in jars makes me excited. I just shake them out.
Did anyone else hear like a little freak nasty like run in the background there?
Did it scare you your first time? You know what? It did. Okay, but I'll tell you why. Normal docs use like saws and just like and cut through the leg. And then, you're like, we do below the knee amputation. So we got to go through that shin bone, right? Because it's better for when they get a prosthesis. But the doctor I had was an old school doctor. So he used this thing called a jiggly saw. Google it. And it's an old school manual, like, and I was like, does it have to be this gruesome? But I couldn't stop watching. It was like a train wreck. I was just like, something's wrong with me. Just pray for me. I don't know what else to tell you. I was intrigued. I love all of it. I love the blood. I love the gore. I don't like eyeball surgery. Not so much. Don't like eyeball surgery. I don't like vaginas. Like any childbirth, I don't like those things. That's not my calling. Some people love it. It's not my calling. I don't know. That those people want to do labor and delivery. I'm like, ooh, every day, same thing. Ooh, it's not my area. I know I got 6 kids, so I don't understand it. Yeah, Crystal, yeah. See, she's my spirit animal.
She definitely is, without a doubt. So Crystal, you should definitely get Nancy's email so that, she can help mentor you as you go through this path. So one of the other questions I had was who were the biggest supports in your life to helping you through that program?
My little non-English speaking mother was my childcare a lot of the way through. My best friend, oddly enough, my best friend has her doctorate degree in sociology. She's a very special, important person. Those have been like the consistents in my life. My dad, those have been the consistents in my life. But honestly, I'm going to be honest with you. When you get in this room, you get honesty. I had deadbeat baby dads. That's what I had. And when you have that situation, be selective in your future. You get to this place where you realize that they're all you have. I'm all they have. And so that was motivation. They were my support. It's crazy as it sounds, these children I would come home after that 24-hour day and my little 5-year-old would come and say, let me rub your feet, Mom. Now they would ask for $1, but they rubbed my feet. So, it becomes a village situation. When you're in my situation, it becomes, everybody has to do their part. And it's kind of cool.
Hannah has a question.
Oh, no, sorry. That was your 5 minutes. So for any more questions, we've got 5 more minutes. So load it up, y'all. You've got Nancy here for 5 more minutes and her genius and her experience.
Oh, that's why my head's so big. All those thoughts.
So you
and her honesty
wisely.
Yeah.
All right, I'm gonna go ahead and ask another question
about Crystal. Was it Crystal that Ashley asked me about me going viral, right?
Yes, and Nutcha just asked, why did you choose nurse? So there's
nursing. Why did I choose? I think I'm a natural nurturer, right? And I'm a kind of a jokester. I'm kind of a clown. I'm not your traditional nurse. But I knew for me that, let me get my battery quick. Sorry, I should have been prepared. I knew for me that I wanted to help people. And everybody else I know that's a nurse, I want to say the bulk, they're sticklers, they're rule followers, they're type A, and I'm very B-ish, B+. I'm very, and I knew that I could heal with laughter. So for me, I thought it was a different way. I meet the niche of people. There are some people who are going to need that type A. I need that order. When you treat me, I need you to feel like, and then there are those people who it's too sterile for them. And I knew that I fit a niche and I could heal those people who needed a laugh, who needed compassion, who needed like a hug, like that weird little, I'm that weird one, right? That I'm very honest and upfront with my patients. And I think there's an appreciation for that. And I think I knew that there was a need for that kind of a person.
That's excellent. Thank you. And now do you want to tell us why you went viral?
Oh, I was same thing. But apparently my son had messaged me last week and told me that I went viral again. So I was like, for another video. So it's just kind of weird. Tip on pursuing a competitive job. How did you succeed in it happily? Okay, listen. If any of you guys are going into the medical field, listen. It is going to be competitive, but there's such a high need and demand that odds are if you don't get in one place, keep going, you'll get in somewhere else because there is such a demand. About being happy, the moment you don't feel happy, transition. The wonderful thing about healthcare profession is you can jump. If self-care isn't enough to make you enjoy your job anymore, because sometimes we all get a little bit, tired and wore down, you find some way to self-care. And if that self-care isn't enough, it might mean that it's time for you to go. It's time for you to do something different. It's time for you to see a change and find out what that new passion of yours is, because we all evolve, right? We all change, we all grow. To be honest with you, when I was in the ICU, it was so difficult for me emotionally. I couldn't detach from some of the things that I saw, that I started bartending every other Sunday. Sounds crazy, but it was my time to see people in a happy space and converse with them and see people have a good time. Sometimes it was just that mental break to knowing that people don't always just get in crashes. People don't always go in diabetic ketoacidosis. People aren't always dying, Nancy. They're not. They're out there in the world living too. And so seeing that was enough for me. You got to find out that thing that keeps you going. If it's not enough, it's time to reevaluate.
That's so excellent. Thank you. That's so true. Do you want to say just like that last, so we have like 1 minute left, so that last nugget of goodness, like what it is you'd want them to know? What's that last piece of incredible?
You know what I want you guys to do? I want you guys, one, to never quit. Whatever it is you're doing, I know it sounds cliche, I know it sounds cheesy, but you know my story, 6 kids deep, okay? But I want you to know that each person you touch is truly like a butterfly effect. Sometimes you're gonna go into this thinking, oh, I'm gonna make all this change, I'm gonna help people. It's not always like that. It's not always it's a thankless job. People don't always come back to tell you. My patients are sedated and sleeping. They're not coming back to tell me thank you, right? You don't always see the end of the rainbow. You don't always see the outcome, but knowing that one change you made, can be so astronomical in the scheme of things. I volunteered at a Boys and Girls Club, and the students came back to me. I did education for them and smoking prevention. And to this day, I have kids come back to me and say, I remember you told me that cigarettes have 2,000 chemicals in them, and because of that, I didn't smoke. To you, it's just like, okay, so one person didn't smoke, right? But it's huge in the scheme of that person now didn't smoke around their kids. Now they're not gonna be subjected to cancer. You have to look at it in conceptually. You can't always look at all the little micro pieces. Look at it as a big scheme of things. Nobody's gonna always say thank you. If you're going to go into this field, know that you're doing it because you really wanna help people, not to receive any accolades and thank yous. It's not gonna happen.
Thank you. You've been absolutely amazing. And I am just so grateful. And I'm so grateful to all the students that have been here and to Hannah for helping as well. But Nancy, just know that you have our heartfelt gratitude for what you do and for being here and taking time. And so thank you so much.
Thank you guys. I'm so proud of you guys already. Wipe me from front to back.